We are at Discover Specific Chiropractic on Hilton Head Island with Dr. Ken, who's been in business for over 25 years here. And we have Paige, and Paige is the neuropathy case manager. So that's what we're talking about today, the neuropathy protocol that has been in existence for a couple of years here at the practice. It's continued to grow. We continue to talk with more and more patients that are extremely happy and have really gone through some tough times, but are so much better because of what you've done. And we've got some data that we're going to talk about. So Paige, I'm going to ask you to share some of the success.
I would love
with our viewers.
At the end of the day, I have a love for math, so this is exactly what I like to see. So whenever a new patient steps into our office, there's many things that we do to assess them, but one of the things that they start off with is, what are your symptoms? What are you currently experiencing? Are you losing your balance? Are you in pain? Can you sleep through the night? Everybody has different symptoms and different issues going on. So we get a baseline as to how that is, what that day-to-day looks like. From there, they meet Dr. Ken. Dr. Ken does an extremely thorough evaluation on them, if you want to briefly touch on that.
Yeah, so we start with a good balance test, and then we'd go through a very thorough test where we check both heat, cold, all the different ways to measure if the nerves are working. And then we also do a floor cam test where we see basically where the blood goes to and how far it's going.
So is it mostly in the feet and the lower legs and then also hands where the neuropathy shows up?
Right, exactly. So where is the furthest from the heart is usually where it starts. So most people is the feet because it's the furthest from the heart. But sometimes it can also be the hands.
And it's cold, it's numb, it could be tingly, it could be painful.
It can be burning, or they can't feel a thing.
Oh, they can't feel a thing.
Yeah, everybody's different, and that's why we always establish the baseline, because you can't treat every neuropathy case the same. It has to be individual. So we establish that baseline. Dr. Ken gets the record of what sensations can they no longer feel. Some people lose the ability to sense sharp, some people lose the ability to sense cold, and that varies depending on the patient. So we establish that baseline. If they're accepted into care, they go throughout the treatment for a certain duration of time. Whenever they reach that graduation point, we do the exact same thing we did on the first day all over again. Wow. So that way we know that compared to themselves, how much did they improve? And that's where I get these fun numbers here. So
drum roll.
What I did is I took the last 20 patients that came through. Technically 21, I just chose that number because it sounded fun, but I did the last 21 patients that came through and I averaged out their success. So when Dr. Ken did their first examination, we get a percentage of sensory loss that they can no longer feel. On average, our patients have felt 58.6% more. Almost 60% more than the first day that they came in.
Does that surprise you, Dr. Ken?
No.
It doesn't?
No. Wow. Like the Andrea you just spoke to, she feels 100%.
Yes.
I mean, there's no difference between her upper and lower. First day she couldn't feel anything.
Wow.
You know, nothing. She had no balance, and now she's great.
And it's treatment here, seeing you, but also at home.
Home therapies,
Home therapies as well.
Yeah.
Exactly. Patients are always responsible for their own dedication. We'll give them that freedom that they're looking for, which is incredible. But other good news is that the symptoms that many patients experience in terms of that pain, tingling, sleeping, cramps, the symptoms reduced by 66.9, so almost 67% a reduction in the symptoms that they're experiencing. Yeah.
That is something to celebrate,
which is incredible.
For sure.
It's huge because a lot of them got severe pains down the leg or severe feet pain. A lot of them can't sleep because of pain.
Yeah.
And most of those that sleep during the pain, most of those pain goes away.
Yep.
Yeah, it's very exciting.
They fill out a sheet of what they've resulted from this, and 71.4% reported improving on their balance. And my favorite statistic, because so many people come in with pain. Now, not everyone with neuropathy has pain, but for those that do, 95.3% of patients have no more pain.
Isn't that cool?
It's time to celebrate.
It's fun.
I know.
Yeah, wonderful. Yes. Great work, both of you.
Yeah, it's exciting.
It is very, very exciting. Thank you.
You should show that too.
Yes, right.
She just did this on her own. I didn't even know she did it.
Wonderful. Gold
it's
star.
Fun.
Gold star. Congratulations
Well done.
to both
Thank
of
you
you.
for
Well
doing
done.
that. Yeah.
Congratulations. And most importantly, it's the patients are happy and they're healthy.
They're getting better.
And they're getting better every day.
Yeah, it's a lot of fun.